we have confirmed 42 new cases of COVID-19. This means that 301 cases have now been identified in our province. We suspect up to 24 of these cases may be community transmission. 18 individuals have been hospitalized and 7 are receiving care in the ICU. There have been no additional deaths. 3 Albertans have recovered from COVID-19 so far that have been reported to us. I would like to take this opportunity now to update you on the investigation into the Edmonton bonspiel with Western Canadian physicians and other healthcare workers that occurred March 11th to 14th. All attendees have been contacted and are self-isolating. We have determined that 11 of the 47 Alberta healthcare workers who attended the event have now tested positive for COVID-19. Many of these are physicians. Some of these individuals worked early last week before notification came through of the case associated with the event, and all contacts are being notified as per usual local public health follow-up. Some of these contacts have been patients. I was able to speak with one of the organizers last night who described the measures that were taken to follow guidelines that were in place at the time. Despite these measures, transmission took place, and the key messages that we can take away from this event are: number 1, even mild symptoms, minor sore throat or runny nose, can result in spread of infection. Number 2, commonly touched surfaces, like serving spoons at a buffet, can be a mechanism for spread. COVID-19 does not discriminate. All of us need to be vigilant with regular hand hygiene, staying home even with minor respiratory symptoms, and keeping unwashed hands well away from our faces. I want to talk now about isolation timelines and testing changes. Earlier today, we announced changes to our isolation and testing protocols for COVID-19. I understand Albertans may have questions about these changes, so I'd like to take a few minutes to address your concerns. First, we've updated our self-isolation timeline for those who are sick from 14 days to 10 days following the onset of symptoms. The most up-to-date medical evidence indicates that if you are feeling well after 10 days from the onset of mild symptoms like sore throat, runny nose, or cough, you will be able to stop self-isolating, again, provided your symptoms have resolved. If symptoms continue past 10 days, self-isolation should as well. This 10-day timeline is for those who are sick. For those who are well and have had an exposure of concern, such as travelers returning from outside of Canada or those who have had close contact with a confirmed case, they will still need to self-isolate for 14 days upon their return or after their last exposure as a precaution. Should they start to experience symptoms, they must also follow the same 10-day guideline. This means that if a person returned from abroad and experienced symptoms after 7 days of self-isolating, they will be required to self-isolate for 10 days from the start of those symptoms. In this example, that would mean their total time in self-isolation, assuming their symptoms resolve by 10 days, would be 17 total days. I understand this might be confusing, and we are trying to make sure that our website is very clear about the 10-day guideline for those who are ill and the 14-day for those who are well after an exposure or return from travel. In addition, we are also adapting our testing approach to ensure we prioritize those who need testing the most. You have heard me talking about a need to shift the use of our testing capacity to enable both capture of some returning travelers with illness, as well as testing those who have not traveled. Going forward, we will continue testing that has been in place for the last few weeks of people who were admitted to hospital with respiratory illness and residents of continuing care and similar facilities. For these individuals, COVID-19 remains a dangerous illness, and access to testing can make all the difference, especially in settings like a long-term care. Additionally, later this week, we will also be adding testing for healthcare workers. This is being done to ensure the physicians and nurses and other healthcare providers we rely on can return to the front line as soon as possible. It also helps us to test some individuals who have not traveled, so we have a better understanding of where there may be spread in our communities. Individuals with mild symptoms who do not fit these categories will not be tested. We will honor any existing appointments that have already been made, but going forward, this will be a change for returning travelers. Returning travelers should all be at home and self-isolating for 2 weeks since their return. They should continue to stay at home, and if they experience mild symptoms, self-isolate for the minimum 10 days from the start of symptoms or until symptoms resolve, whichever is longer. This new approach, which has been adopted in other provinces, reflects the fact that the number one thing you can do if you have mild symptoms isn't to get tested. It is to stay home and self-isolate away from others. I understand some Albertans may be upset with this change. I can appreciate the comfort and certainty that testing can bring for those unsure whether they have a minor bug or COVID-19. It is important to remember that the majority of people who get COVID-19 will experience minor symptoms. For those who do experience these symptoms, there is nothing better you can do for yourself and others than to stay home and self-isolate away from others. We need to remember that because the incubation period is 14 days, it would take 2 weeks from whenever we implemented any new measure for us to see what effect that might take. So I think we should expect that there will be additional new cases that we will see because we're still seeing after effects of exposures that happened up to 2 weeks ago. In terms of success, I think that this is clearly a very contagious illness. It's something that no one has immunity to. And so we need to closely monitor those community-acquired numbers, especially as we shift our testing protocols. And that will help us get a better understanding of what is happening. It'll also help us determine, again, whether or not we're at a place where we might need to move into more aggressive measures. Whatever we put in place, we will need to sustain for a period of time, because the measures we're putting in place don't make the virus go away. They just slow down the rate of spread so that we don't end up with a steep peak of many people getting sick all at once and then coming down the other side. So it may actually sort of push out the spread of the disease further as that curve is flattened. It has been close to a week since strict measures for social distancing and mass gatherings were put in place. And with the warm weather now approaching, I can understand the need to get out and enjoy the sunshine. Again, I reiterate the importance of practicing physical distancing whenever you are out in public. I do encourage people to go for walks and enjoy being outside, and at the same time, it is extremely important to maintain that distance between others. Whether it's the Glenora Stairs or heading up Nose Hill, please be careful to maintain a distance of 2 meters and to avoid touching rails, garbage cans, or other potential sources of transmission. I especially caution Albertans against planning trips to provincial parks or the mountains, where many washrooms, restaurants, and facilities are closed, and where it is possible that large crowds could form. Now is not the time for travel. I know that these measures we have put in place continue to strain families, businesses, and all Albertans. And I appreciate how hard it is to be separated from friends and family during such stressful times. It's important to remember that we are all in this together. Now more than ever, we need to take care of each other. This means now, more than ever, keeping a physical distance, and now, more than ever, finding creative ways to maintain our bonds and stay socially connected.